My name is Stephen Dewan. I'm a cardiovascular surgeon. I work with cardiovascular and thoracic surgeons here in Austin. Been here for 30 years practicing.
My name is Frank Zadar. I'm an interventional cardiologist with Austin Heart. I practice at the Heart Hospital of Austin. I'm part of the multidisciplinary valve clinic and here to talk to you about the MitraClip.
A MitraClip is a new device that's been designed to be implanted in the leaky mitral valve to reduce the amount of regurgitation or leakage of that valve. It's implanted in a less invasive approach to basically reduce the regurgitation or leakage of that valve.
Mitral regurgitation is a leakage of the mitral valve. The heart valves should all be one-way valves. They become problems if they're leaking or narrow. So when the valve is leaking or regurgitant, blood is flowing in the wrong direction when the heart contracts.
This demonstration here shows the leakage of blood in the wrong direction. All the blood should be flowing in one direction through this mitral valve. That blue represents the regurgitant volume. Now you see the clip in place, the leaflets are captured, and once you're satisfied by ultrasound or TEE that you've effectively reduced the regurgitation or leakage, you can then release the clip and take the system out, and all that's left behind is the clip itself. Here you see before the leaking valve, after addressing the leakage.
So Ms. Lawrence, she's 90 years old and moved here from Alabama earlier this year. She had several hospitalizations for congestive heart failure symptoms, which we think are related to this severe mitral regurgitation. And she continues to struggle with congestive symptoms, and she's undergone an evaluation for the MitraClip procedure.
And this valve certainly looks like it's repairable with a MitraClip. She has severe central regurgitation with normal left ventricular function, which would make her an ideal candidate for repairing this with a MitraClip.
So our partner, Dr. Bott, has her on optimal medical therapy, and despite that, she's had recurrent heart failure and multiple hospitalizations. Given the fact that she's 90, advanced renal insufficiency, all those things putting her at high risk and adding to her complication and potential mortality with surgery, I think she'd be a great candidate. And I think we could really impact her quality of life in reducing her heart failure symptoms and keep her out of the hospital.
I'm Margaret Lawrence. I'm 91 years old. I was having to go to the hospital so often with pneumonia and congested heart failure. My doctor, Dr. Bob, told me about it, and he said there was a team that was studying this and had been studying it for quite some time, and wonder if I would be interested in getting this hole in my heart closed. I don't know of any other place I'd rather be if I had to be in the hospital and then to be in this place, because they're all so friendly and they're so helpful, and they make you as comfortable as possible.